think public health education really has a lot to do with creating programs, interventions, and initiatives to really enhance the knowledge, attitudes, skills, and behaviors of individuals. When I'm teaching my students, the undergraduate and graduate level, I like to focus on a few different areas. So specifically about prevention, there's 3 different levels of prevention. So primary, secondary, and tertiary prevention are really important to focus on for public health education. So I like to primarily focus on primary prevention because that is going to stop the risks and decrease the risks for individuals in the first place. Secondary, we're going to screen for the risks, and tertiary, we're going to help resolve some of those issues that come up. But for public health education, primary prevention really is the most ideal way to focus and target that area. As you can see here in the background, I also have some other areas I like to focus on: the socio-ecological model, which has 5 levels. A lot of times public health education focuses only on the individual, and I think that's a mistake because we have a lot of health theories and models that do focus on the individual, but it also is a collaborative effect, and they really all work together. So focusing on the individual is one way, but I think it really also needs to incorporate interpersonal relationships with those around the individual, the community around that individual, organizations that they're involved in, and society as well. So that goes from the knowledge, attitude, skills, and behaviors of the individual all the way up to changing policy to help many different individuals. And then the biopsychosocial or the wellness wheel approach is really important too, because looking at all different dimensions of wellness is important, not just physical health, which I think a lot of people focus on. So for public health education, we don't want to just focus on physical health. We have intellectual health, we have spiritual health, we have emotional health, occupational health, social health, environmental health as well. So it's really all encompassing of lots of different dimensions to be able to help keep that individual balanced and healthy.
Thank you so much.
Also, one last thing I did want to say, there's different organizations, as you mentioned about APHA. We're both involved with APHA, and they have a section, public health education and health promotion, and they really like to advocate for health education, health promotion for individuals, groups, communities, and systems, which I think is important so that it unifies a lot of different public health education professionals. Also, Society for Public Health Education, SOPHE, focuses on health initiatives to support individual health behaviors and also influence policy. So again, looking at the socio-ecological model, seeing all the different levels to incorporate. So I think it's great to have organizations on the national level and international level to be able to incorporate and support public health professionals too in the public health education endeavors. So I think that's important as well.